Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Ehlers-Danlos Syndrome, also called EDS. Ehlers-Danlos syndromes are a group of heterogeneous, clinically variable disorders of synthesis of fibrillar collagen. So the Ehlers-Danlos syndrome is a connective tissue disorder. There are defective collagen genes or the defective enzymes for post-translational modification of collagen. Mode of inheritance is either autosomal dominant or autosomal recessive. Prevalence is 1 in 5,000. There are 6 distinct forms of Ehlers-Danlos syndrome. There are also some overlapping and some additional type of Ehlers-Danlos syndrome. Tissues rich in collagen like skin, ligament, joints are frequently involved. Okay, so you got that. Okay, so here we look at the image here. Skin is here, folded loose skin over the knee joint. There will be thin atrophic scar in this person over the knee joint also. And there are some spheroid under the skin. Skin is so thin. We're seeing some spheroid, some small calcified substance here. Okay, the spheroids. And if you look at the image of a dad and his son, father and son, look, they can easily extend the skin. Skin is very lax, like him and like him. Okay, these are the features of Ehlers-Danlos syndrome. There will be also hyperextensibility of the joint. There are heart problem like mitral valve prolapse. There may be aortic aneurysm. There may be chance of rupture of the sigmoid colon. Okay, and there may be chance of dissecting aneurysm of the aorta rupture. That is possible. There may be chance of subarachnoid hemorrhage in the body. Okay, so there are multiple problems. May be variable from one type to another type, but these all are connective tissue disorders. Okay, classification of Ehlers-Danlos syndrome. Classic type, autosomal dominant. Mode of inheritance. Clinical finding include joint and skin hypermobility, atrophic scar, and easy bruising. Type 2 hypermobility, type 3 here, classic type 1 and 2, hypermobility type 3, autosomal dominant, clinical finding again hypermobility of the joint, pain and dislocation of the joints. Vascular autosomal dominant, this is the most dangerous. Clinical finding includes skin, arterial or uterine rupture during pregnancy. During pregnancy, there is chance of rupture of the uterus, especially in the last trimester of pregnancy. But pregnancy may be possible normally in many cases, but there is more chance to get uterine rupture in a patient with Ehlers-Danlos syndrome. Bruising and small joint hyperextensibility are the features of vascular or type of Ehlers-Danlos syndrome. Okay. So these are again some feature joint hypermobility. Okay, hip joint may be dislocated. Recurrent dislocation is possible also. There may be organ rupture. Person is unable to turn off the candle lights. Okay, during pregnancy there may be rupture of the intestine, bladder. There may be rupture of the sigmoid colon is also possible. Okay, skin may be pulled outward and there may be pain also. There, easy bruising, aneurysm and subarachnoid hemorrhage. Okay, especially there is damage to the berry aneurysm involving the circle of Willis. Okay, so we got that all are the features of Ehlers-Danlos syndrome. This is due to the defective collagen synthesis. Okay, so blood vessel also defective. There is chance of vascular damage and joint hypermobility, skin. These are the features of Ehlers-Danlos syndrome. Here, kyphoscoliosis type. So vertebral column may be curved forward, may be laterally bended. Autosomal recessive clinical finding includes hypotonia of the muscles, joint laxity, congenital scoliosis, that is the lateral bending of the vertebral column, and ocular fragility. There may be rupture of the cornea. There may be retinal detachment, mitral valve prolapse, and aortic dilatation. That means aortic aneurysm. Even the dissecting aneurysm of the aorta is also possible. Arthrochalasia type 7AB, autosomal dominant. Clinical finding includes severe joint hypermobility, skin changes, scoliosis, bruising, again congenital hip dislocation. Dermatopraxis type 7C here, type 6, 7C, autosomal recessive. Clinical finding includes severe skin fragility, cutis laxa, bruising, and hernia. Hernia may be inguinal hernia, hernia may be hiatal hernia, may be incisional hernia. Diagnosis is based on clinical finding. Laboratory tests include biochemical and gene testing, plain radiograph, echocardiogram to find out is there any type of mitral prolapse, aortic aneurysm, plain radiograph to find out any type of joint problem. Okay. Treatment, there is no cure. It is a genetic disorder, no cure. Patients should avoid contact sports. And patients should also avoid pregnancy. There may be rupture of the uterus, more chance to get rupture of the uterus, if possible. Genetic counseling is very important because it is autosomal dominant, autosomal recessive. So the next generation would get the disease, Ehlers-Danlos syndrome. In autosomal dominant, there is 50% chance. Autosomal recessive, around 25% chance to get the disease. So genetic counseling is very important. Management of skin and joint problem, management of blood pressure. We need also physical therapy, management of pain if it is present, consultation with a vascular surgeon, dermatologist, cardiologist, and orthopedic surgeon. So they will help any complication, but this disease has no cure. And that's all about the Ehlers-Danlos syndrome. If you have any question, please feel free to ask me. Please share the information with your friends. Have a nice, wonderful, and blessed day. Please support my channel. Please subscribe me. Bye now.